We are going to start with one more topic of the lower limb. Commonly asked for the 10 marks question, long question, that is a venous drainage of the lower limb. So it is very important to know after the studying the superficial veins of the lower limb, and we have come across the deep veins. So when we studied the superficial fascia of the front of the thigh and lower limb, there we come across that is the veins of the lower limb. So you are going to get the veins of the lower limb, which are you are going to see like this margin. This is the landmark which is you can see. So veins of the lower limb are divided as you can see by the schematic diagram of the lower limb. So veins. You have come across this is the dorsal venous arch, and that is very important. You should know because it begins the having the medial end and lateral end. So that you are going to get the medial side, we are going to get the beginning, that is the medial end, that is the great saphenous vein. Then going to the lateral one, which is we have the short saphenous vein. So these two veins we have come across in the superficial fascia of the lower limb, that is the contents. So what is the importance of this venous drainage of lower limb is why it is important. Upper limb is okay, cephalic, vesic, axillary vein draining, but lower limb venous drainage of the lower limb is very important because venous pressure is low, less than the arterial pressure, and this venous pressure from the foot to it has to ascend to the heart. It against the gravity it has to ascend and opens, and that deoxygenated blood in the right chamber of the heart, right atrium. Means what? Why it is important? Because venous blood is already pressure of the venous blood is less comparing to the artery, and in that the lower limb venous blood has to ascend upward and reach to the heart. So this is the one which is a very important because low venous pressure, and they have to reach into the against the gravity blood has to ascend and has to go towards the heart. So this is how it is nature given us the many factors which are responsible for the venous returns of the lower limb. There are general factor and local factor which are helping for this venous return to ascend from the lower limb, that is from the foot to the thorax. So this is why important you have to know venous blood is always that is a low pressure having, but it has to take the vein ascends towards the heart because of the against the gravitational force. So here we can divide the veins into a superficial and deep and perforating vein. In the venous drainage you have to know the schematic diagrams of the lower limb veins. In this we can classify the veins of the lower limb into superficial, deep and perforating veins. These superficial veins I have told the dorsal venous arch and the great saphenous vein, and we have the small saphenous vein. These are the superficial veins which you can see in the that is a diagram, that is a dorsal venous arch, great saphenous vein, short saphenous vein are the most superficial veins of the lower limb. Okay. Then deeper veins which we can see the peroneal, anterior tibial, posterior tibial, popliteal and femoral veins. So all these will be the deeper vein. When superficial, always I have told the blood flows from the superficial to the deeper veins so that they are connected from the perforating veins. The veins connect from the superficial to the deeper veins. Always blood flows from the superficial to the deeper vein, and that is by these perforating veins. So that we can classify the veins into a three parts: superficial vein, those are the great saphenous vein, short saphenous vein, and deep veins we are going to have those are the peroneal vein, anterior tibial, posterior tibial, popliteal vein and femoral vein. So these all veins are covered, so that you should know that. Then perforating veins which are connecting the superficial to the deeper one, which is we call. So that this diagram, outline of the veins diagram, you have to remember, and you can this dorsal venous arch which is lying on the dorsum of the foot formed by we are going to get the dorsal metatarsal veins, and digital veins. Dorsal digital vein forming the dorsal metatarsal vein. These dorsal metatarsal vein forming the dorsal venous arch. Dorsal venous arch can be asked as a short note. You should know this is formed by the medial and lateral. We are going to get the marginal veins and the dorsal metatarsal vein. That is a dorsal venous arch. Then I have told the short saphenous vein and great saphenous vein we have dealt. Then deeper to this, we in the leg we have the peroneal vein, anterior tibial, posterior tibial vein, popliteal vein, and this is a femoral vein. So these are the deeper and superficial and perforating veins of the lower limb. So how this venous blood of the lower limb ascends upwards, and what are the mechanism is present here, or what are the factors responsible for the venous returns of the lower limb has to go from the femoral vein to the abdomen external iliac vein to the common iliac inferior vena cava, then that is opening into the right atrium. So this is a very important to draining of the lower limb venous blood to the heart against the gravity, so that the blood how it is reaching to the heart, that is important. So there are some factors which we are going to deal. This is a schematic diagram, that is as I have told, and these perforating veins which are represented in this diagram. So in this you have to remember there are so many important factors which we classify, that is factors helping for the venous return. So first one, general factor and local. We can classify these factors into a general and local factor. General means in generally what they affect. Local means the part where they traveling the veins, that factors are responsible. Those we call as a local factor. So that you have the 4 general factor and 3 local factors, which is you have to know. One general factors for the venous return is a negative intrathoracic pressure. When we inspire the air inside thorax, expansion, that creates the negative intrathoracic pressure. In the thorax, there is a negative intrathoracic pressure that causes the sucking effect towards the chest, towards the thorax. So that this sucking effect is caused by the negative intrathoracic pressure, and this negative intrathoracic pressure is created during we are going to call as an inspiration and yawning. So this condition we are going to get always during the inspiration. There is a negative intrathoracic pressure that causes sucking effect towards the thoracic wall, or the thorax, towards the thorax, means thorax in that the heart is situated. So this is one general factor which is responsible for the venous return of the that is the lower limb blood. Then vis a terego. Vis a terego means compulsion from behind. See, always there is a production of arterial pressure is more, then this will overflow the capillary bed. There is due to the arterial pressure is more, so that there is a capillary, small minute branches of the arteries we call capillaries, and these capillaries are having the anastomosis and capillary beds. From capillary beds, these are overflowing, so that this overflow of capillary beds due to the arterial pressure, that also helps the venous returns of the lower limb towards the thorax. So that is we call vis a terego, and that is we call as a compulsion from behind. So that is the one which is factor which is you have to remember. Next comes from the arterial pulsation. See, when you see the all the lower limb arteries and veins, there is a deeper vein always accompanied by the arteries. So in the content of femoral triangle, you take femoral artery, femoral vein is there. In the popliteal fossa, popliteal artery, popliteal vein is there. Then in the leg you go, that is the anterior tibial artery, and that is the posterior tibial artery. Then in the foot we have the dorsalis pedis artery. So these all are the arteries are there. They are very accompanied by the veins. So that is always artery is near to the vein. So that artery is always pulsating. Artery is pulsating. So this pulsation of the artery, where side by side or near to that is the vein, so that will cause the pulsation or a compression over the artery, that also supports the venous returns to the thorax, towards the thorax. So that this is very important. Arterial pulsation, pulsation is there, vein is side to that, there is an always compression of the artery due to the pulsation, that will causing the, that is a venous return to the upward. So this is we call accompanying veins which are there. There is a compression of the artery by the pulsation of the artery pulsating because of the pressure, then that is always compresses the vein, and that compression helping to venous return. Then lastly we have in the general factor is, there is a walls which are there. I have told the difference between artery and vein. Walls always present in the whatever the veins you are going to get. These walls function is, they always pump the blood in one direction. Unidirectional blood flow is done by the these wall maintained. That is we call column of blood. Column of blood is maintained by the wall. Once blood is pumped, that does not comes to the back to the same size because of the presence of the wall. So these all are the general factors of the venous returns of the lower limb. Question will be asked, that is what are the factors responsible for the venous returns of the lower limb? What are the factors responsible for the venous return of upper limb is not asked. So can be axillary vein, basilic vein, cephalic vein, median cubital vein, short notes can be asked. But here you are going to get the, that is the, why it is important I have told, it is because of the low pressure venous blood has to ascend against the gravity. So I have told 4 factors, which is negative intrathoracic pressure, viscer pterygo, pulsation of the artery and walls of the vein. So these all 4 factors which are responsible for the general factors responsible for the venous return. Then we have the local factors. When you see the veins of the lower limb, you are going to get they are more muscular. As because of that only we call as a soleus is a peripheral heart. This effective back of leg muscle contraction of these all veins by the back of leg muscle or calf muscle, that we helps to the venous return of the blood. So this is the one which is you have to remember. Veins of the lower limb are more muscular than the any other part of the body. Then second one, muscular contraction. Effective muscular contraction is there because when we walk, when we run, slight flexion at the knee, this also helps the contraction of the leg muscle. That also helps to pump the blood towards the upwards. So this is the one muscular contraction in an active limb. Active means when you are running, walking, that time compresses the deep veins and that will drive the blood upwards towards the deep veins. Then tight sleeve of that is a deep fascia. This deep fascia of the lower limb is very tough and tight sleeve. I have told in the fascia lata when I have taken the lecture on deep fascia of front of thigh. In that I have told the deep fascia is called in the fascia lata. It is a tough seat-like covering which envelops the whole thigh and leg. This deep fascia of anywhere body, then that it is a tough and seat-like. So seat-like is there means it causes the effective compression over the veins and which will help to venous return. So this is a tight sleeve of the deep fascia, make the muscular compression of the veins much more effective. So this is the one which is you have to remember. Local factors are at the regional level means lower limb. What are the factors which are affecting? That is I have told veins of the lower limb are more muscular. Muscular contraction is more effective than which drives, and deeper vein will drive the blood, and deep fascia of the lower limb is tough and sleeve-like, and that will causes the effective compression. So this is all about the general and local factors of the venous returns of the lower limb. So these all you should know, and then you have to tell the what are the veins of the lower limb. So So I have told superficial, deep and perforating vein, all that is told. So this is all factors which is you have to remember. This is the word which is you have to remember, vis a terego, and that is a compulsion from behind in the general. And you know when you yawn, there is a creation of the inspiration and you are going to get the increased chest wall, making the, that is a negative intrathoracic pressure, which will negative intrathoracic pressure means it causing the sucking effect towards the thorax. It will pull the blood venous towards the thorax. That you have to remember in the, that is a negative intrathoracic pressure, that is. Then arterial pulsation you know, then valves you know. Valves function is asked. Veins are having the maximum valve towards the distal part and they are having the function, main function of the valves are they maintain the unidirectional blood flow. So that is the one which is you have to remember. Then going to the these veins you can see here short saphenous vein, which is you are going to get the lateral end of dorsal venous arch. It runs passing behind the lateral malleolus and runs along the midline of the leg, and in the middle of the leg it climbs to the reaching to the popliteal fossa, and in the popliteal fossa it opens into the popliteal vein. Great saphenous vein opening into the femoral vein, and this short saphenous vein opens into the popliteal vein. So course of the short saphenous vein can be asked. Great saphenous vein, last exam great saphenous vein is a long question asked, that is a 10 marks. So you should know that is very important. And short saphenous here, it is running on the lateral end of dorsal venous arch, runs passing behind the lateral malleolus. Very important because great saphenous vein it runs the in front of the medial malleolus. These are the landmarks which is you should remember. Great saphenous is running in front of the medial malleolus, but short saphenous is passing behind the lateral malleolus. So running its course in the leg region, it reaches to the popliteal fossa and opens into the popliteal vein. So this is the course of the short saphenous vein. Here we have completed the great saphenous vein, short saphenous vein. I have already taught you the femoral vein, popliteal vein. So those in the femoral triangle contained and all I have told. So this is you have to remember. Then next which is you have to remember about the in the applied anatomy. Here you have to remember the one most important. This is we call as an varicose vein. So one first here in the applied anatomy you have to tell first calf pump. Calf pump, CALF, calf muscles are the back of leg. Those we call as a soleus and gastrocnemius. Contraction of these muscles causing the effective contraction, and that we call as a calf pump. So venous blood of the lower limb is ascending upward due to the contraction of the calf muscle, and this is we call as a calf pump. Okay. Then same way you have to explain that is a why soleus muscle is called as a peripheral heart in this. So that is relates to the calf pump, and why soleus is called as that is a peripheral heart I have taken. So that is one. Third applied anatomy you have to explain varicose vein. These are the dilated, lengthened, tortuous vein due to the incompetence of the valves. Veins having the valves, what is the function of valve? They have to maintain the unidirectional blood flow. If it is not maintained by the valve, then valve fails to maintain, and that is condition we call as an incompetence of valves leads into a varicose vein, and these varicose veins are we are going to get it is a lengthened, tortuous, dilated vein is called as a varicose vein. Where is a common factor commonly seen in these varicose veins, varicosity? It is commonly seen in the professionals of the long standing. Even lawyers, long standing, they have to fight for the case in hours together. Neurovascular surgeon, farmer, traffic police, they are going to have the even agricultural workers where farmers, I have told, they have to stand for the longer period in the field. So those people are commonly prone to have the varicose veins. So that is the one which is you have to remember. So this is all about the great saphenous vein course. I have told medial end of dorsal venous arch in front of the medial malleolus, running along the medial border of the leg, passing behind the knee and inclines forward to reach the saphenous opening in the thigh region. That is about the great saphenous vein. So this is all you have to remember. This is short saphenous vein, opening small saphenous vein or the short saphenous vein. Saphenous means easily seen, as I have told in the great saphenous vein. Saphenous means easily seen. Here you can see the great saphenous vein, medial end of dorsal venous arch, in front of the medial malleolus, along the medial border of the leg, passing behind the knee, and it inclines forward to reach in the thigh. It opens into the femoral vein. This is a short saphenous vein. This is commonly asked in the long question also. Last exam it is asked as a long question, 10 marks question. You should be able to write. But short saphenous vein you have to deal. This is, I have told, this is the one lateral end of dorsal venous arch, passing behind the lateral malleolus. On the back of leg it runs in the middle and it is opens into the popliteal vein in the popliteal fossa, ending there. So this is what you have to remember about all these veins, and what is a varicose vein, what is a perforating vein, what are the lower limb veins. I have told we can group into a superficial, deep and perforating. Perforating are those veins which communicates the superficial to the deeper. Blood always goes from the superficial to the deeper. This concept you have to remember. Then deeper veins are there issuing blood from the superficial to the deep. These deeper veins should be compressed. Then only these veins will pump the blood upward. And those factors I have told, general and local factors of the lower limb venous drainage. So in the clinical anatomy, calf pump, phi soleus called peripheral vein and varicose vein. These three you have to write in the applied anatomy of the that is the venous drainage of the lower limb. So question will be asked, venous drainage of lower limb. In that you should able to write the why it is important. Lower limb venous drainage is important. You have to against the gravity, as it is a low venous pressure. This is important. Then these lower limb veins, how they are superficial, deep and perforating. Second point. Third, what are the responsible factors which are helping to return the venous blood to reach the thorax or the heart is a general factor and local factor. Then you have to explain the clinical anatomy of the lower limb. So these are the heads you have to remember. Even this you can write calf pump, phi soleus called the peripheral heart. That all will be included in the lower limb venous drainage. So this is all about the lower limb venous drainage, and this diagram you have to practice. That is a very important. So all the simple diagram which is you can practice the outline. You can draw for the all femoral vein, popliteal vein, small saphenous vein, great saphenous vein, anterior tibial, posterior tibial, peroneal. Question is asked about the dorsal venous arch. So these all 5 to 6 questions. This is the one you have to draw the diagram. So this is you have to understand about the what is the why importance of the lower limb venous return is important and what are the factors. So that is all about the this is all about the venous drainage of the lower limb. Okay.